Good afternoon. I'm Steven Sikafus and my partner Joey. He's going to help us explain the hypoglossal nerve to you all. It's also known as cranial nerve 12. So just first we're going to break down the word hypoglossal just so we better understand what that means. So the prefix hypo means below or beneath, and glossal, the suffix, means tongue. So as we can put that together, that means beneath the tongue. So cranial nerve 12 innervates the muscles beneath the tongue. So I'm going to go ahead and hand off the torch to Joey here, and he's going to talk to us a little bit about those muscles.
Alright, as Steven said, the hypoglossal nerve innervates the muscles of the tongue. So there's 8 of them in total, and they can be divided into 2 main groups, so the extrinsic and the intrinsic. There are 4 of each, and the hypoglossal nerve innervates all 4 of the intrinsic tongue muscles and 3 out of 4 of the extrinsic tongue muscles. So we're going to take a look here at the screen, and there you can see that's all of the extrinsic tongue muscles except the palatoglossus, which you can't see from this angle, but you'll be able to see in the next slide. So here along the right side of the screen, we see all 4 of the extrinsic tongue muscles, including that palatoglossus right there at the top. And then along the right hand side of the screen, we see the intrinsic tongue muscles. So those are named according to the direction that they run. So superior longitudinal runs the length of the tongue, superior to the other muscles. Then inferior longitudinal runs beneath the other muscles, the length of the tongue. And then right in here in the middle, you see kind of a mesh design of the muscle fibers. So the vertical running fibers are going to be the vertical, and then transverse are the transverse fibers.
Right. So now we're going to explain the pathway leading up to the innervation of the tongue muscles by cranial nerve 12. So it begins with motor or frontal cortex, and then it travels down to the medulla. And then from the medulla, that's when the innervation begins. So that's cranial nerve 12, and then it leads to those tongue muscles. So if you look at our little picture here, we have our medulla there. It comes right down to our tongue muscles.
So next we're going to talk about lesions to the hypoglossal nerve. So a lesion could occur up in the cortex where the signal originates, or in the medulla, or in the hypoglossal nerve itself. So a lesion would cause difficulty with speaking, swallowing, eating, anything that uses the tongue muscles. So a lesion to the hypoglossal nerve itself will cause atrophy of the tongue muscles. It's ipsilateral to the lesion, so that means that if the lesion is on the right side of the hypoglossal nerve, then the right side tongue muscles are going to be the ones affected.
Alright.
So to test the hypoglossal nerve to see if there's a lesion, we are going to first of all ask our partner to stick out his tongue. Alright, thank you. And we are going to observe for any atrophy or difficulty with the movement. So next we're going to ask our partner to touch the tip of your tongue to the sides of your mouth. Alright, and again looking for any atrophy or difficulty. Alright, so next I'm going to place my hand on my partner's cheek and ask him to push his tongue into my hand. Alright, and then on the other side. Alright, and there we're checking for the strength of those tongue muscles.
Alright, and that's how you test cranial nerve 12 and all the functions of it. If you have any questions, comment below and make sure to subscribe to our channel. Thanks guys, see you later.